everyone, this is Dr. Nguyen.
And I'm Lan. We're with DPC Health, your membership-based clinic. Today we're starting off the Medical Care Redefined podcast again to kind of reignite our conversations about medical care and why we do what we do. And so to get started, we're just going to talk about our direct primary care practice because I think that's like the big thing that we love to do and that we continue to do for the past 4 years, right, Dr. Nguyen?
Yes. It's one of my favorite things. I love practicing DPC. I was in the fee-for-service for a while, and I hate the fact that I didn't have time with my patients. Now, it's just today seeing how much improvement in health patients are doing. They're losing weight, their depressions are better, their mood are better, the confidence are better. It just really does make me want to come to work every day. It really does.
Yeah, and I think the same with me. Like, I like to work with people who are passionate about what they do, and Dr. Nguyen definitely is a passionate doctor. And I think the direct primary care model itself, because we're membership, we don't take any insurance, and so we're cutting out the middleman of having to deal with insurance, doing all this billing and the coding. Like, you pay the monthly membership fee, you get access to everything we do, and if you need anything, you call or text us. So like the access to care is there, and Dr. Nguyen really works to build that patient-doctor relationship with our patients, which I really love. Yeah, and I wouldn't imagine doing it anywhere else.
Yeah, I used to do weight follow-up with my patients over in a fee-for-service. I used to work for a big system, and it was like a 5-minute in, 5-minute out. There was no way that I was able to really answer all the questions that my patient have. It's like if they come in for one thing, that's the only thing I can handle. I can't talk about anything else because can't bill it all together. So I hated that system because I couldn't really take care of patient altogether. Here, when my patient come, they have a laundry list of things. They could ask whatever they want, and then they forget. They text me, and I still respond with the spruce messages. So I feel like in this model, I really do, or our team really take care of the patient as a whole, and they don't feel like anything is unanswered.
Yeah, for sure. And I think what makes our membership unique, not just in a direct primary care setting and other doctor's offices, but like Dr. Nguyen kind of structured the membership to cater to her patients in all the way that she can. So kind of a brief overview on our membership. For $85 a month, which is our tier 2, Dr. Nguyen gives 24/7 access to her medical team and doctor, right? So let's talk about that a little bit.
Yeah. So 24/7 access. You guys call us anytime. Like literally, I always tell my patient, but the nice thing about the way we structure is that because we take care of our patient so well that whatever the question they have in office or after hour they text, we always take care of it. So it's rarely that my patient will text me at 2 o'clock in the morning to ask something unless it's an emergency. So even though some of my patients are like, how do you handle like being on call 24/7 all the time? The truth is because we take care of our patients so well when they need us. So therefore, like they don't have emergency at 2 o'clock. It's very rare that occur. So I actually tell my patient, if you are sick, you're throwing up at 2 o'clock, I want you to call me. If I'm still sleeping, wake me up because I want to be the one who take care of you. But we rarely have those calls because we take care of our patients so well.
Yeah, and I think some practices out there, I heard like if you ping the doctor at 6 o'clock, you get charged like a fee. And we try not to do that because we really want to avoid our patients going to the ER or having to go to an urgent care. So we recommend you calling us first for anything that you need. Like we're your hotline for that. And then if there is like any clinic visits that you need, come in as often as you need to or as you want to. We try to cater to same day, last minute appointments, especially if you're sick or you're feeling under the weather. Dr. Nguyen has seen patients like outside of office hours on the weekends.
That's right. And then kind of going back to that, like we always take care of our patient whenever they need it. So majority of the time, it's very rare that our patient needs something on the weekend, but if they do need it, we take care of them. But especially if it's a laceration, right? So, last summer, I think the kids were swimming and it was a Saturday and they jumped into the pool and had a laceration. I don't want that kid to be stressed out going to the hospital with a doctor that they don't know. They already know me. So I was like, hey, meet me at the office. I sew you up. It was quick and easy, and then they go their way. So that's kind of the way that we do things, and it really does make me happy because I feel like I'm that old school family medicine doctor that, my patient can holler at me at any time.
Yeah, and I think in comparison to a fee-for-service world. Now, like if a patient needed direct access to a doctor in a fee-for-service world, like what usually happens? They have to call, they have to wait 2 weeks just to get an appointment to see their doctor. If they feel sick, like they're doing COVID tests, flu tests, like strep tests, just to even like make sure that's all clear before they can even step foot into the office. So it's like inconvenient for patients. It's not other doctors' fault, but like in that fee-for-service world, they're really on insurance time. Like they only get so much time that they want with their patients. And then if a patient needs like a teledoc, I think you worked for teledoc before. Like, how does that usually go compared to what we do?
Yeah, so in teledoc, it's kind of like you call and then you list like all the symptoms beforehand already, but then there's no personalization. It's literally call, okay, here's some antibiotics, and that's it. Like they don't even know like what is their other history, what else is going on, and you might be getting an antibiotics every single time you call, but then you could develop resistant to that, and you may not need the antibiotics, but the doctor ain't gonna have time to talk to you about like what things you could do to prevent and all that stuff. So it's very non-personable type of approach when you do that.
That's true. Yeah, and I think like you have to repeat your family history or your medical history every time. You sit in a virtual waiting room, so it's like here we already know your info. You paid your call list, and we'll be able to take care of you through that. But let's talk about physicals. Like I think Dr. Nguyen does much more comprehensive physicals than other doctors. Like tell us a little bit more about that. What is it that you do differently?
Yeah, so in our model, like when we do our physical, the big thing is that we kind of, even though we do all the basic stuff, skin check, we do, in women, we do breast exam, pap smear. In men, we also look at all the skin to make sure there's no cancer or anything. We have a dermatoscope that we look really, like a dermatologist would do. And then on the other hand, the big thing that I do on every single patient is a body composition. And I think that like a lot of doctors will do their weight and their height and look at the BMI of a patient. But what our body composition does, it looks at the percent body fat, the muscle mass, the water retention, their face angle, how healthy they are, their visceral fat. All that helps me to evaluate the patient's overall status. Like some of the patients, they want to shred a little bit more fat. They want to gain a little bit more muscle. So everybody can always improve, especially our older patients who have something we call sarcopenic obesity. Their BMI may be normal, but when we scan it, they see that, their fat mass is high and their muscles is very, very, very little. Well, we need to kind of really take care of those patients and encourage them to eat more protein, strengthening exercise, so that they have more muscle mass. So as they get, because really the truth is, as we get older, we lose fat, we lose muscle and we gain fat. So in those patients, we really want to encourage them to optimize their health so that when they get older into their 70s and 80s, they don't need to be in a wheelchair. They're not using a walker. The truth is, nobody wants to, have somebody else take care of them, So this is kind of where my goal is, to encourage my patient to be healthier at a younger years, unlike just saying, your BMI is normal, just whatever you're doing. The body comp really gives us a more true of like what is their composition looks like. So based on that, we help like do a true physical exam for that. We also do EKGs to look at, because most doctors are like, why would you, they don't do an EKG on everybody.
Yeah.
The reason why I do an EKG on patients who are above 40 is that to have a baseline. Because when a patient comes in, they're having chest pain, I want to know what is their baseline like. If there's EKG changes, then that's when it's an emergency or not. If it doesn't change, then, that's pretty safe. So that's the reason why we do that, to kind of look at everything as a whole.
Hi, everyone. Thank you so much for tuning into our podcast episode. This is just a friendly reminder that our membership is as low as $85 a month for all your primary, urgent, and emergent care needs, as well as personalized services and weight loss and hormone replacement therapy. Here is a testimony from one of our DPC Health family members.
Hi, I'm Stephanie, and I've been a patient for 2.5 years. And I think that the reason I keep coming back and I tell everybody about DPC is the doctors here listen, they care. Everybody here listens and cares. They believe you. And that's hard to find in healthcare. And I struggled with migraines for close to 20 years. And it was just progressively getting worse, where I was having migraines 3 weeks out of a month. And now I maybe have a migraine every 6 months, just because the doctor believed me, and she just did like basic blood work and found out that my vitamins were deficient, that my hormones were crazy. And so just by balancing those, I don't have to take any more medication for migraines all the time. So it's literally changed my entire life, and I couldn't be more happy to come. And that's just one of many things that she continually helps me with, just my weight journey and just overall well-being in your body, but also your mental health. So it's just really fantastic. I love everybody here.
Yeah, and that's great because I think in a fee-for-service role, like a body composition analysis, nobody has that. They probably never even heard of it. If you need an EKG, sometimes they're going to refer you to like a cardiologist because they don't have time to mess with that. If you need a skin examination, they're going to refer you to a dermatologist. If you need pap smear breast exams, sometimes like more women stuff, they'll refer to a gynecologist. So instead of doing all of that for our patients, we have the time to allocate to them in this direct primary care role, which I love because I think it makes such a difference, right? On top of that, Dr. Nguyen is also board certified in obesity and functional medicine. So we also provide weight loss and hormones as well. So let's talk about weight loss. Like what do you think if a patient is interested in weight loss, what makes our weight loss different than other ones?
I think that like our weight loss program is superb to everything that's out there. The reason being is that we look at all the causes of the obesity disease, right? Because a lot of people, like if you go to one of those weight loss clinic, what are they doing? They're only focusing on like maybe telling you to buy their food or like certain food that like you go strict on diet. They may provide you with weight loss medicine and yeah, you could lose weight, but they're not looking at everything else because obesity is a disease. It's caused by multiple factors. So the things that we're so different is we look at everything else. We look at your hormones. Your hormone imbalance can cause you to gain weight and like not resistant, right? And then your stress. Stress can cause increase in cortisol causes is weight gain. Are you sleeping okay?
Yeah.
Is your vitamin D adequate? Because those are things that can cause weight gain. Are you a certain medication that causes you to gain weight? We need to look at everything as a whole because what we don't want is you to lose the weight and gain it back. Because if all these things are the hindering piece, then we want you to help. Our goal is to lose the weight and keep it off. So the way that we look at obesity and how to help our patient lose weight is we look at all of it. What are the things that's causing you to gain weight? So then I will work on all of it simultaneously. We got to work on your sleep. We got to work on your stress. We got to work on your hormone balancing so that when you lose the weight, you can keep it off. Because I don't want the yo-yoing ain't all that great. So we don't want that to happen.
Yeah, for sure. And I think what I love about what Dr. Nguyen does for patients is like she makes it super easy to like start off. Like I think a part of the rules of weight loss is like doing a little bit of a walk every day, right? Like you're not asking them to go out and like go powerlifting. In a sense, you're asking our patients to just like start moving, being active. And then even like food wise, like I think I hear you lecture patients about like, okay, if we're going to go to a party, we're going to eat some cake. Like what do we need to eat first in order to have that piece of cake, right? So it's like, I think it's so accessible for patients and it can be personalized too. I think when I talk about our weight loss program to patients, I can always say like, you know, if you want to incorporate medications, you can, or injections, you can, or if you want to do more lifestyle changes, like Dr. Nguyen's going to cater to that, right? So because not everybody is the same.
Yeah, and I think that's why our weight loss program is very unique. I cannot say I do the same thing for everybody. Some patients, they're like, hey, I only want to do lifestyle change. I'm not ready for medication. Some of my patients, I've done all of it, Dr. Nguyen. I've eaten right, I've exercised, I'm not losing the weight. Throw the kitchen sink at me. Give me everything, right? So I always kind of like gauge my patient and see what are the things that they need, where are they at in their journey, and then how aggressive do they want to be, and then from there we kind of work on a plan together. I do truly believe in medicine as a personalized approach, but when we work well with our patient, they'll be more compliant. I'm not one of those that's like, hey, you need to do this, or else, you know, I kind of meet together. And some of our patients are very, and it depends for where the background is. They want to be more holistic. They don't want to be on prescription medicine. They want to be on supplements, which is fine, understand. So we'll kind of like more focus on that supplement side of things. Sometimes we need a little bit of both. So I think that being able to be that functional physician, that kind of like being the best of both worlds, where you could do a little bit of this and a little bit of that. But yeah, that's something that I'm really passionate about, and I love what I do is because I'm able to kind of like put a little bit of everything together to really optimize our patients.
Before we listen to our next patient testimony, we just want to remind you that DPC Health is available for small businesses too. As a small business owner, you can contribute as much or as little as you want towards your membership for your employees. We also provide mobile services so we can come on site to your workplace whenever you need us to. Let us be your medical team and doctor at DPC Health, where medical care is redefined.
My name is Manuel Lerma. I've been a patient for a year, and the way it started was my wife was the one that brought me here because I didn't know there was something wrong with me. So I was gaining weight. I was falling asleep actually a lot. I would be talking to people and I would just, fall asleep. And, it was there was something wrong, but I didn't want to admit it. And she was like, it's time to find a doctor and take you, go get your help. even though I was against it because I was like, I'm fine. And, we ended up here and find out, like, I had diabetes and then low testosterone, my blood was thickening. There was a lot of things that was happening. So it was a reality check. So, and after that, I got on track, got healthy, losing weight. And my wife was inspired also that she wanted to lose weight. Well, she made the appointment to come to the doctor. And from there, she was, I guess they were doing the physical. And when, I guess they felt a lump or something, we ended up finding out that she had breast cancer. So we ended up catching it just in time, like the beginning stages. So if it wasn't for one thing, if it wasn't for my thing, we would have never found out hers. So, and the doctor here, she's been very helpful. Any questions that we had that she would answer. So, and she always, through the text messages, I think, that we have on the computer or something like that, you can tell she's passionate about it. She loves what she does. And I can honestly say it does feel like family here. So, and I love it here.
Yeah, and I think overall, like what we vouch for here is we're like your health coaches and your team. Like we're not, here to lecture you or tell you what to do, but we're here to help, engage you and empower you to do what you want to do, whether it's losing weight or not. So I think that's always very unique for us in our practice. Let's talk about hormones. Like I think that's also, a
my favorite
personalized
topic.
approach.
But anyway, I say that, but everything is my favorite topic because I love medicine so much. Right?
Yeah.
But yeah, hormones. It's I see. I make patient cry a lot. I say that. I don't intend to. But, like in the past few days, I've had a lot of female patient come back to me. And, when one of the patient came in earlier and she said, when she came in to see me, she said, I have, talked to a lot of different doctors, endocrinologists. I've talked to my primary care doctor. I've talked to all sorts of people. I feel so bad. I'm tired. I'm fatigued. I'm brain fog. My hormone, like my libido is bad. And everybody tells me that my lab looks normal and there's nothing else to do. That's part of aging.
Yeah.
And then she cries to me and I can't lose weight and all this stuff. And so with that being said, after that, I was like, okay, well, let's kind of work with you. And so I've been working with some of these patients, like for her particularly over the past few months, and she's lost like 20 pounds and her hormones are now balanced. She's sleeping better, her mood's better, her libido's better. So she's like, Dr. Nguyen, I wish I've seen you sooner. And things like be able to rebalance the people when their hormones are off and rebalancing them, it changes their lives and make them so happy and making them feel like they're worthy of being around, right? And so it really does excites me to do these kind of stuff is because it's not just about we're changing lives one at a time, and it just really does excites me to see these patients so happy.
For sure. And I think that, like, I'm always the first person that people talk to when they're, like, interested about DPC. So I get to kind of engage them a little bit more. And I hear that a lot. Like, patients are coming to us saying that, everyone says that I'm fine, the normal is in range. So I guess, like, for this particular patient, in a brief summary, like, what did you do? What was it different from your approach than other doctors that were doing for her?
I think that other doctors look at it and because a lot of physicians are not trained in hormone therapy, and that is the truth. And unfortunately, when I was in residency, I was never trained, and it was because our patient, a lot of our patient was not losing weight, right? Especially a female patient, or even men when they're testosterone low, they're not losing weight. And I was looking for what is the cause of it, and a lot of patient complained of things. And back then when I finished residency, I was just like sloughing it off because I don't know what to do with it. But then because of that, I researched more. I decided to, I got board certified in functional medicine because I wanted to learn enough about it. Once I understand that there's a lot going on, I listened to the patient. I think that was the big thing. It was listen to her. What symptoms was she having? And then I was like, okay, your symptoms looks like your estrogen's probably low, your progesterone's low, your testosterone's low. Let me check the levels. And so the level being low confirmed that. And so okay, let's try treating you and see how you respond. And the truth is sometimes we don't get it right in the first month, but then if we don't get it right, you're not feeling the best yet. Maybe you're feeling 30% better, but you still got another 70 70% to go, then we still work on it. It's like, what else can we tweak to get you to that point? And that was what that patient was. I listened to her. I just wanted to listen to her and see what she's saying. Every time she improved a little, Dr. Nguyen is improving a little bit, but I still feel blah, blah, blah. I was like, okay, let's adjust this a little bit. Yeah. So it's been a few months to finally, we got it right. And so it's just exciting to see that.
It is exciting, yeah. And I think patients like don't realize that like, if you're getting older, you shouldn't feel like less of yourself. Like it is for hormones, and once you get your hormones balanced, you're gonna feel like normal. Like you shouldn't blame it on old age. I think that's like the main topic. Like yeah, I
think the common women, it's so sad saying like, you know, I'm 40 years old and I have a low libido and I'm feeling tired. That's normal of aging. I was like, girl, you're only 40. You got another 60 years left. Yeah. I mean, that 60 years of like feeling tired, fatigue, brain fog, low libido. You got, you know, you got to really make a change in that because that's 60 years of like, that's not even half your life yet.
Yeah.
So I think that we need to stop settling for feeling bad.
I like that. We should. So yes, overall, I mean, we kind of gave a gist of like what our tier 2 $85 membership covers. So that's literally everything from physicals, your weight loss, your hormone therapy, all your clinic visits. And you like for $85 a month, I feel like that's so much inexpensive than insurance, right? And we like to pay, like we like to practice what we preach. So like we don't even have insurance ourselves. And like when we talk about DPC to patients, we try to pair DPC with other things that are accessible to patients as well. And so if you're looking for something that's more catastrophic, then I recommend Zion Health Sharing. I use it myself. So a lot of our patients use it, right? And so they work in the same way, membership style, and you have an IUA, which is your deductible. And once you meet that deductible, all of the bills that you want to submit to them medical-wise, if it's listed in their little category book, then it's considered shareable. And I think that's so great. And I don't like, have you signed up for
Yes,
Zion?
I just signed up with my family and all my kids. Everybody, we're under Zion now too. So really, like for us, we don't really, you know, need anything because, like in most of our patient too, the DPC took care of all of it. So it does cover for colonoscopy, mammograms, so things like that.
Even immunizations for kids. Yeah. So all of that fun stuff. Was it easy for you to sign up on that?
I just went on there and just put all the information. It was really easy.
And I think if you select like you're a DPC Health member, like you get a discount. So that's always super fun to kind of talk to patients around that. And then we have other options like if you just want ER coverage or if you need help with dental and vision, like we work with partners. We try to advocate for our patients so that they find like everything they need and they don't have to like go to, you know, the insurance marketplace to even buy insurance. I think that's the best part.
Yeah, because I think that one of the reasons why I was switching was initially we had insurance because I was pregnant, had a lot of, you know, with my kids and stuff. And I think it was almost $2,000 a month for our family.
Wow.
And so now I think it's like $300 or $400 for our whole family. So I was like, and it's covering everything I need. And, you know, so it was pretty simple. So it really, it was a no-brainer for me to switch.
I think it does cover pregnancies too. You just have to be a member for some time. So a lot of great things with Zion Health Share if anyone's interested in that. But I just kind of want to tie this all in a little bit more because it is open enrollment time. So like not only does DPC work for individuals and people who are self-employed, but it works for small businesses and employer groups too. So tell us what you love about working with employers because I love working with them. Yeah.
So I love working with employers because every time we have a employer in Denton that we would come out there like every few months to like we bring our van out there and then sometimes we'll kind of go into their location if they want us to go in there. So we see our patients out there, we draw blood, and it's just kind of really cool to be able to take care of all the employees. Like they don't have to go anywhere, we could come there. And then it really does, the employers really like it is because they cut down their calling in sick time. When a patient is sick, we'd call in an antibiotic for them. So it's like a shorter treatment versus like if they need to go to see their primary care or whatever, it takes them a few weeks to get in or a few days to get in. And so by the time they get better, it's like a lot of time off, right? Yes. So for us, it's like when they're sick, we take care of them right away. They have a laceration, we take care of them right away. So the turnaround time for them, like, so they cut a lot of time being at work. And I think that a lot of our patients that are they really like it is because they really do get everything they need from us. And then the cost is very minimal because sometimes some of the employers, they'll pay 50%, so it's like $85, right? Then they only pay like 40 something per month, and the employees are paying it's like what, $10 or $20 a paycheck or something like that.
So you can split it up with your employees. You can contribute as much or as little as you want. If you're not ready to contribute, like we can kind of coach the patient. Like $20 a week gets you a tier 2 membership. But I think it's great because like small businesses, like if buying insurance for your employees is going to be costly and you don't want to pay that much when you need to like spend your money elsewhere. And so this is a great addition to offer to your employees because now you're like showing your employees that you really care. And because we're coming on site every quarter, like we'll take care of your patients. There's no gap in their healthcare needs. They don't have to take time off work to see us. So it just kind of increases like employee morale and it decreases absences. If they are sick, we can contact HR directly and just work with them. So it's like, it's a fun aspect, I think, that we provide with our DPC and our mobile van and all of that fun stuff that goes with it. So I really love it.
Yeah. I mean, we, like one of the other employers, they're like, 15 minutes down the street from us. And initially she came in, she started losing weight. She's doing so well. She tells everybody in the office. And so now everybody's looking great because everybody's losing weight and their hormones are balanced. So it's just kind of cool because then now your employees are healthier. So they're more productive because like, oh, my health is good is because of my employer taking care of me. So it's really cool to be able to see that.
Yeah, and we've worked with other employer groups that have employees like spread out in different cities, so you can always do a telemedicine plan, or if you really need us to, like we can take time like once a year to come on site to see employees. We've also worked with like insurance brokers to kind of like pair it with like a high deductible insurance plan or be able to like code it so that, you know, some of the employers can save money if they're like working on their premiums and things like that. So a lot of great options there. I think it's unique and fun to work with employers, especially now that open enrollment's coming around. If you're considering it, let us know.
Yeah, absolutely.
Yeah, I guess to wrap it up, Dr. Nguyen, like tell us what you hope to see DPC Health like grow to in like the next few years. Like what is your plan or your hope for your patients here?
I hope that our, bringing more providers in our team to be able to like kind of be able to provide more care for our patient. I think that I am very passionate about medicine, but I think that if we have more physicians as passionate as me, they also will have like more skills set that they can bring in. They have more input that they can bring in, and all that providing to our patient. My hope is that, like especially for this year, we've added on peptide therapy, which is like molecular medicine, increasing our quality of care for our patient, bringing medicine into the next level, like where other physician or other clinic, there's no way that can be able to do. Like, what we're doing is we're doing primary care stuff, but we're doing weight loss, we're doing hormone therapy, we're doing functional medicine, we're doing peptide therapy, we're doing things that are actually beyond what others are providing. And so we want to kind of continue to optimize our patient's health. Like, and I always hear me talk about, I want my patient to be A+ patient, like to be the best that they can be so that when they age, they don't have to take a lot of pills and I don't want them to be in a wheelchair. I want them to travel the world and enjoy life. And that's kind of our optimal goal for DPC as a whole. And I think what my hope is, as the coming years to come, we will continue to provide that. And as we excel with our patient. And as we do well, our patient's health should be even better, right?
Yeah, and I think overall, like we've been doing this for about over 4 years, and I think it's been so fun. Like us starting it out together, we were like new to this. We did everything hands-on, all the marketing, all of the the structuring of the business, and just being able to get to know our patients on a personal level. That it's just been so much fun. And for me, like our logo and our motto is redefining medical care, and I think that's so important. If we can continue to do that, I think we touch so many lives that way. And hearing the stories and the feedback that we get from our patients, like it's life-changing for me just to even be a part of that. So I hope that we continue to change our lives as we go.
And I mean, like, it's been 4 years, right? But every year we're adding something new, and it doesn't cost you more. Like I always got, like, it doesn't cost my patient more. Like, we added the weight loss stuff, we added the hormone, the functional medicine, the peptide. Like we're adding more value to the membership as we grow, but we're not like the cost is not more either, though.
So yes, it's been exciting here. We hope you will continue to join us on this journey. If you're not already a patient, schedule a consult with us. If you are a patient, thank you for always supporting us. We appreciate it. Again, my name is Lan.
And I'm Dr. Nguyen.
We're with DPC Health, where medical care
is redefined.